Hi, I'm Ashley, and welcome to A Sound Constitution here on CHLY 101.7 FM, a show where we focus on health topics important to our community. Our goal is to demystify health issues and address common misconceptions by sharing evidence-informed information from a variety of reliable sources. Your hosts today are Ashley, Cassidy, Tyler, and myself. All information provided on our show will be available in our show notes on our Facebook and Instagram pages. We want to remind our listeners that the information presented in this show is for educational purposes only and does not replace the advice of your primary healthcare professional. If you have any questions or concerns about what's being discussed, feel free to reach out to us on Facebook at A Sound Constitution, Instagram at CHLY A Sound Constitution, which is all one word, Twitter at ASC_BIU, or email us at asoundconstitution@gmail.com. We would like to start our show by acknowledging that we are on the unceded territory of the Snamo people with a broadcasting range that overlaps the Kwotson and Sliman territories. This acknowledgement is done with gratitude to the Snamo people and with the intention to increase awareness about the truth and reconciliation processes and efforts on Vancouver Island. Additional information and resources surrounding the Snamo history, reconciliation, protocol, and land acknowledgement can be found on our Facebook, Instagram, and YouTube pages. Today, our focus is on gut health. Our star guest on the show today is Dr. Yim, a naturopathic doctor working at VitaCare Natural Health Clinic on Bowen Road in Nanaimo. We first learned a little bit about Dr. Yim, how it would look like getting in to see a naturopath, then move on to questions on the circulating term, the gut is our new brain, followed by questions regarding gut health supplements and how we can improve our own gut health. If this topic is interesting to you, stay tuned to hear the abundance of knowledge Dr. John Yim has to share. So before we start the interview, Cassidy has some information she would like to share regarding gut health. So go ahead, Cassidy.
In this quick segment, we're going to look at a few common digestive issues and how they're treated in general practice. Irritable bowel syndrome, or IBS, is a common digestive disorder characterized by symptoms such as repeated abdominal pain, changes in bowel movements, and bloating. Doctors often treat IBS by recommending changes in what you eat or by exploring medicines, probiotics, and mental health therapies. Our second disease we'll look at is gastroesophageal reflux disease, or GERD. GERD occurs when the ring-shaped muscle that normally prevents stomach contents from flowing back up into the esophagus doesn't function properly. The most common symptom is heartburn, and doctors typically treat this with lifestyle changes and over-the-counter medications such as antacids. The third disease we'll look at is Crohn's disease. Crohn's disease is a chronic or long-lasting disease that causes inflammation and irritation of your digestive tract. The most common symptom of Crohn's disease are diarrhea, cramping, and pain in the abdomen. Doctors treat Crohn's disease with medication, bowel rest, and surgery. The goal of treatment is to decrease inflammation, prevent flare-ups of symptoms, and to keep you in remission. Our last disease we'll look at is celiac disease. Celiac disease is a chronic digestive and immune disorder that damages the small intestine. The disease is triggered by eating foods containing gluten. Celiac disease can cause long-lasting digestive problems and keep your body from getting all the nutrients it needs. Symptoms of celiac disease widely vary from person to person. Some examples include bloating, chronic diarrhea, constipation, abdominal pain, and nausea. Celiac disease is treated by following a gluten-free and well-balanced diet. The information provided in this segment was sourced from the National Institute of Diabetes, Digestive, and Kidney Diseases at niddk.nih.gov and will be provided in our show notes following the episode.
All right, well, thank you so much for sharing that, Cassidy. And now we're going to begin our interview with Dr. Yim, where we get to know a little bit about him and expand our knowledge on gut health. So, Dr. Yim, why don't we start with you telling us a bit about yourself and what influenced you to become a naturopathic doctor?
Sure. I was born in Hong Kong, and for the first 4 to 7 years of my life, the only medicine I knew was traditional Chinese medicine. That's what our family used in Hong Kong. So it wasn't until coming to Canada that I was exposed to Western medicine. And so when I got older, I started becoming interested in sports and nutrition. And I thought I didn't know what I wanted to do as a career when I got older. But I knew I was interested in health and nutrition, and I didn't really have much inkling about other alternative medicine other than what I was exposed to is, traditional Chinese medicine. But when I was in grade 12, one of my classmates, his father was a naturopathic doctor here in town, and Dr. Kirkbride, he graduated in 1930 at a university in Chicago that granted a dual chiropractic and naturopathic degree. And so that's how I first knew about naturopathic medicine. But even then, I didn't know that that's what I wanted to do as a career. So I headed to physiotherapy school, but I didn't get accepted in my first year. My grades weren't good enough. So I thought, what else could I do in the realm of health that I could make some money and, work towards other fields that would interest me? So I found out about massage therapy. And at that time, there was only one massage therapist in Nanaimo. She had graduated from the school that I eventually went to just the year before. And so I contacted her, and she said, yeah, it's a great program. You have to go to Toronto, but it's worth it. Long way to go. So I enrolled. That was in 1982. I became a massage therapist. So I was the second massage therapist in Nanaimo, and now there are all kinds of them. And they're all busy, doing well.
Wow.
So, but Sandy and I, we were the pioneers, and at the time, we were struggling to make a living because many people didn't know the therapeutic benefits of massage. Medical doctors weren't referring, ICBC wasn't covering it, extended medical wasn't covering it. So it was difficult to make a living. And eventually I thought, I'm going to go back to school and become a naturopathic doctor. So I went to Malaspina College, which became VIU, got my prerequisites. And in 1990, I uprooted my family, my wife and two young children. They were 3 and 4 months old. And we moved down to Seattle for 4 years. And I did my doctorate in naturopathic medicine. And at the time, there was one school in Toronto and 2 schools in all of the US. So there was 3 naturopathic colleges in all of North America. And I think even today, there might be 7 or 8 at the most. So it's still a fairly exclusive training, right? And, it was a gamble because, you're heading off to the States to get a degree, in a field that hopefully you can make a living at. And at the time, other than Dr. Kirkbride, I didn't know that many naturopaths, and I didn't know what kind of an income they made. I didn't know how successful. I just knew that it was something that really interested me. And so, just on, I guess, on the assumption that, it was something I was passionate about, I did the training and did my board exams, that I wrote them in Vancouver. And so here you spent 4 years of your life and tens of thousands of dollars, and your livelihood depended on passing these friggin' board exams, right? And if you didn't pass your board exams, you could still write again, but it was 6 months before you could write again. And here we were, incomeless for 4 years. So my family was very dependent on me passing those board exams. And thank goodness I passed them on the first try. When I got back to Nanaimo and waiting to get the results of my boards, I'd done a couple of lectures and I had my first week fully booked. And my fear was having to phone those people and telling them that I'd failed my board exams. Thank goodness I passed the first time around.
How
and that
stressful.
was 29 years ago. So
Wow.
I've been in private practice for almost 30 years. And, today we're talking about the gut. And over the years, that's become my focus. And we'll talk about why, I feel it's such an important system of the body. So that's just a real brief overview.
Yeah, thank you.
Here.
Yeah, such an interesting story. Thank you for sharing.
Yeah, you're welcome.
Yeah. So you said it took you 4 years?
But most incoming students now, they require a degree because it's so competitive. There's Boucher in New Westminster only takes 34 students a year.
Oh, wow.
And the school in Ontario takes 120 a year. So, it's very exclusive. You have to have a degree now. So it's basically 8 years to become a naturopathic doctor.
Wow. That is dedication.
Mm-hmm.
Yeah.
So, Dr. Yan, what does the process look like for a community member to get an appointment with a naturopath?
So as a naturopath, we're considered primary care providers. A person does not need a referral. So they can pick up the phone, call our office, make an appointment. And I think there might be a couple weeks waiting list, but
Okay.
yeah, they just phone the office directly.
Okay, that's not too bad. Yeah, compared to trying to get to see a general practitioner.
Oh
It's
yeah,
what a
yeah,
crisis in Nanaimo right now.
there sure is. Yeah.
Yeah. So if someone chooses naturopathic therapies, what kind of health coverage options are there?
So unless somebody's on premium assistance, and you have to be very poor to be eligible for premium assistance, then they get, I think, $23 a visit. Many of my patients that are working, they have extended medical, and all the students at VIU have extended medical. So, a good portion of the visit would be covered. But for the person that doesn't have extended health, then they're paying out of pocket.
Mhm.
And, that does limit access to some people because, again, you know, if you go to a medical doctor, even if you're on welfare, it's covered. Everybody has access to conventional medicine. But unfortunately, there is a barrier financially for some people to access naturopathic medicine. That's unfortunate.
That is unfortunate. Yeah. Thank you for sharing that. So, a phrase is trending right now that our gut is the new brain.
Yeah.
I'm just wondering what your thoughts are surrounding this idea.
So my feeling is that the enteric nervous system is what runs the gut. And there are so many nerves involved there. And there's more nerves in the enteric nervous system than there are in the central nervous system below the brain.
Mhm.
And every neurotransmitter that's produced by the brain, there are receptors for in the gut. So whatever the brain is feeling, the gut feels, and vice versa. When the gut produces neurotransmitters, the brain picks up on those neurotransmitters. So there's communication between the gut and brain. But having said that, the gut can work completely independent. Years ago, doctors used to feel that ulcers were caused by stress and overproduction of acid. So for a while there, they were cutting the vagus nerve, the main communication link between the gut and the brain. And what they found was that in spite of doing that, it had no effect on ulcer formation at all. And the gut could continue to perform its duties independent of the brain. So, in fact, some of the neurotransmitters that are really important for how we feel, like serotonin, doctors prescribe serotonin reuptake inhibitors for mood regulation.
Yep.
Only 10% of the serotonin in your body is produced by your brain. 90% is produced by the bacteria in your gut. So the
Wow.
bacteria in your gut has a tremendous impact on your mood. And many of my patients with depression, one of the areas that I'm treating is their gut. So
Mhm.
isn't that fascinating that we have this symbiotic relationship with these microorganisms in the gut? It's fascinating, isn't it?
It is fascinating. Yeah. That's so cool. Okay, so in your experience, what are some common misconceptions about healing the gut?
So some of the misconceptions are that there are conditions that are beyond treatment. For example, IBS. A lot of my patients come to see me with that diagnosis. And basically, it's a wastebasket diagnosis where patient is experiencing, bloating, abdominal pain, possibly diarrhea, possibly constipation, or alternating. And with all the tests that are done, whether it's scoping or blood work or whatever, there's no pathology that's identified. There might be some mild to moderate inflammation, but there's no lesions, nothing that explains these symptoms. So eventually the patients are told, you have IBS. Basically, that's doctor code for, you have these symptoms. We can't find anything wrong. Go away. You have to live with these symptoms for the rest of your life.
Mhm.
And it's absolutely not true. The majority of these patients, and we'll talk more when I talk about treatment, I find that the majority of these patients, there are three factors: food allergies, dysbiosis, stress are three factors that can predispose a person to what we call IBS. And all three are treatable, right? And I have patients that have been, had this diagnosis for 25 years, and within 3 months, they're 100%. So once we identify the cause of the problem, we can treat them.
Yeah, it's considered the upstream approach.
Yeah. Other misconceptions are symptoms need to be treated in a way that blunts the symptoms but doesn't cure the problem. And a big example of this is heartburn. Antacids are highly prescribed, right? Proton pump inhibitors. Proton pump inhibitors are the new class of antacids, right? Usually in the past, they were H2 blockers like Zantac, Prevacid, those things block acid production by about 60%. Well, these new class of proton pump inhibitors will block acid production by 90%. So of course, if somebody has reflux or, heartburn or, gastroesophageal reflux disease, GERD, that class of medication will manage symptoms. But unfortunately, you do not have reflux because you have a deficiency of proton pump inhibitor. You have reflux because something isn't, weakening the tone of the valve at the top of your stomach. So if we can identify the trigger and deal with that, we deal with the reflux. And, people don't realize how damaging this class of medication is. If you block your acid production, the three main things that stomach acid does, one is it sterilizes the gut. So you block somebody's acid production, you're decreasing their ability to sterilize their gut. So bacteria that's not been dealt with can get through the stomach down into the intestines. Number two, in order to break your proteins down and digest your food, hydrochloric acid initiates that process. So if you're blocking acid by 90%, you're messing with people's digestion. And then the third thing is absorption. All your minerals and things like B12, they require an acidic environment in your stomach to be well absorbed. You alkalinize that environment, you're interfering with mineral absorption. You're interfering with B12 absorption. So you prevent certain things from happening by blocking acid production, nasty things that can go on in the esophagus. But the studies show that patients that are on these drugs for 5 or more years have increased risk of bone fractures. And many of these people that are on these drugs, they're seniors and they're already at risk for osteoporosis. Well, you put them on this class of drugs, you're guaranteeing they're going to get osteoporosis. And most seniors within 1 to 5 years of a hip fracture are dead. That's the stats.
So sad.
That's sad. That's scary sad.
I've worked as a HCA for 6 years.
Yeah.
And I've seen it. Yeah.
Yeah. And so, there's absolutely no doubt that there are problems around digestive health. And it's one of the more common things that people see their physicians about. But unfortunately, they're not well addressed and they're not addressed properly. And hopefully, I can give your viewers some ideas of, how to really take care of their digestion today.
Yeah. Well, you have my attention, so I'm sure you'll have all of our listeners' attention too. I find
in between.
All right. Thank you, Dr. Yim. We're just going to take a quick break where Ashley provides us with a myth buster on human poop. Yes, you heard me right. Poop.
Mythbusters!
Thanks, Ashley. Typically, at the sight of human feces, most people tend to steer away and be slightly grossed out, which makes it so hard to believe that human feces can cure so many conditions and diseases. Fecal transplants are an extremely effective treatment. This treatment basically requires placing the stool of a healthy person into an unhealthy person and allowing a new healthy microbiome to grow. So let's listen to a quick TED Talk to learn what a fecal transplant is and how it works, with Catherine Stevenson, a physician scientist in the Center for Virology and Vaccine Research and the Division of Infectious Diseases at Beth Israel Deaconess Medical Center in Boston, and film production by David Suskind.
It might seem unwise to consume feces, and today there aren't many doctors who would prescribe Gi Hong's recipe. However, exciting new research suggests that taking poop into the body in other ways might benefit our health. One such treatment is fecal microbial transplantation, and the secret to how it works lives in your gut. Trillions and trillions of bacteria, viruses, fungi, and archaea consider your bowels their home. Collectively, these microbes make up what's known as your gut microbiome, and each of these organisms possesses dynamic, specialized abilities that seem to be essential for human life. They break down our food, make vitamins, train our immune system and circadian rhythm, and even protect us from infections. In return, they receive a nice warm place to live, complete with an all-you-can-eat buffet. Some research suggests our microbiomes might start forming in the womb, but if not, they certainly get started when we're born. During a vaginal birth, infants take in some of their mother's fecal matter and microbe-filled fluids. From then on, our microbiomes are constantly diversifying with exposure to various foods and environments. This is essential for maintaining gut health. If poor nutrition, chronic disease, or antibiotics disturb this delicate balance, the body can become vulnerable to problems like bacteria and fungal overgrowth or infectious diarrhea. But infusing a new batch of microorganisms into the intestine seems to help reset the gut microbiome. This is where fecal microbial transplants come into play. This line of treatment is still very new, and there are tons of unanswered questions about how it works. So currently, the U.S. Food and Drug Administration only allows doctors to use fecal transplants experimentally for battling one of the toughest gut infections, antibiotic-resistant Clostridioides difficile. This infectious bacterium forms spores in the colon that are immune to antibiotics and very difficult to destroy. Patients dealing with this infection can experience months of intermittent fevers alongside bouts of abdominal cramping and extreme diarrhea despite antibiotic treatment. So when symptoms get this bad, it's time for a fecal microbial transplant. To start the process, a gastroenterologist first retrieves some feces, typically from a stool bank. These frozen samples are particularly impressive number twos. The selected donors go through a strict process to ensure their samples are infection-free. In fact, these protective protocols are so stringent, one prominent stool bank's acceptance rate is less than 3%. Next, the gastroenterologist gets that sample inside the patient via a pill, or more commonly, a tube into the stomach or colon. Finally, the transplanted microbes migrate through the tract until they find the colon, where they quickly multiply and displace the infectious invader. This process is so effective that it cures over 80% of patients in just one treatment. Because each stool sample is unique, the FDA still classifies fecal transplants as an experimental treatment rather than a formal medication. But promising research in rodents suggests new ways we might use fecal bacteriotherapy in the future. For example, fecal transplants from non-diabetic mice improved insulin resistance in mice with type 2 diabetes. So it seems entirely possible that altering a patient's microbiome could allow for multiple new modes of treatment.
All right, well, thank you so much, Ashley, for sharing. And now we're going to return to our interview with Dr. John Yim, who is a naturopath working at VitaCare on Bowen Road in Nanaimo.
So what are some of the most common gut health complications you've seen, and how would you treat them?
Well, so I mentioned with the irritable bowel, that's the most common that I see. And mostly because, patients are not getting help from other places and these symptoms are persisting. So usually I'll do food allergy testing. And, if you go to an allergist, the most common form of food allergy testing is skin scratch testing. And skin scratch testing is best for what we call immunoglobulin E, IgE mediated immediate reactions that show up within minutes of exposure. The challenge is there are IgE allergies for sure, but most people that have those type of allergies would have figured those out, right? Because every time if you eat something and within minutes you have hives on your face, or you're running to the bathroom with diarrhea, or you got a pounding headache, those are easy. It's the delayed allergies that are hard to figure out. So delayed allergies are more immunoglobulin G or IgG mediated, and they can show up hours or days after eating a food. So it's very difficult to identify those type of reactions. And those reactions are sometimes quite mild, and it depends on the amount and the frequency. So it's not always just once. So some people say, well, I had that food the other day and it wasn't a problem, but then 2 days later I had it again and I had a problem. Well, 2 days later, they might have had 3 things that they're sensitive to, and that was the second day in a row they had it. So, looking for food allergies that are delayed, in my mind, they're also food sensitivities. And in my definition of food sensitivity, it's where a patient reacts to food, but there are no antibodies. A good example, people suspect they're gluten allergic, and they go to the medical doctor and they get a blood test, and they're tested for antibodies against gluten. Oftentimes, they're test positive, and they're told, yes, you're celiac. But a number of people can do the same test and be told, no, you're not celiac. And yet those same people, they know when they don't eat gluten, they're way more comfortable. And so I tell those patients that have that experience that you're probably gluten sensitive, which means, yes, you're having symptoms, but you're not carrying antibodies. And, many people find gluten and the dairy proteins highly inflammatory to the lining of the gut, but they're not necessarily allergic to those foods. So there are immediate reactions, delayed reactions, sensitivities, and then intolerances. So that'd be like the lactose intolerance, where people are just lacking the enzyme to break down the milk sugar. So yes, you can have bloating, you can have diarrhea, but if you're lactose intolerant, you're not allergic to the dairy protein, you just can't break down the milk sugar. So if you use lactose-free products and you're using lactase, the enzyme, to break down the milk sugar, no problem. So with IBS patients, we got to figure out what the irritants are. And we look at foods because it's something that we can control, right? We're eating, several meals a day. We get to choose what we put in our body. If I can help my patients identify what those irritants are, then we take a load off the gut. The second most important thing is dysbiosis. And this term means an imbalance between the healthy flora in the gut and unfriendly organisms. And when you think about the gut, we have millions of bacteria in the small intestine. We have trillions in the large intestine. And so this balance between friendly bacteria and unfriendly organisms is very tenuous, because there are all kinds of things that can throw that balance off. Things like antibiotic use, traces of antibiotics, in our food supply, herbicides and pesticides, which also have antimicrobial activity, chlorinated water, stress, alcohol, anti-inflammatories. There's so many different things that can upset the level of your friendly organisms in the gut. So if your friendly bacteria levels decline and the unfriendly organisms like yeast, bacteria, climb, then that's dysbiosis, right? And so the most common dysbiosis can be fungal, so Candida albicans, or it can be bacterial. And we tend to talk mostly about the large intestine when we're talking about IBS. But another condition, so identify the irritants, right? Find out, is there a dysbiosis condition? Treat, bring down the levels of unfriendly bacteria. So you're resting the gut by identifying the foods the person's sensitive to, identifying if there's an overgrowth of unfriendly organisms in the gut, using natural antimicrobials to bring those levels down, populate the gut with more friendly organisms, in some cases using digestive enzymes to assist in the digestive process, and then doing things to heal the lining of the gut, whether it's small or large intestine, so that we make that barrier nice and intact again. So that's the most common thing I see is irritable bowel.
I definitely hear about it a lot.
Lots of people have. Yeah. Another condition that is becoming more prevalent, and you may not have heard of, and let me know if you have, is small intestine bacterial overgrowth, or SIBO.
Haven't heard that
No.
one.
So IBS is more of a large intestine problem. SIBO, from its name, is in the small intestine, and it's a bacterial overgrowth. Now, it's not something that you picked up. The bacteria that causes SIBO are bacteria that are normally found residing in the large intestine in large numbers, because remember, there are trillions in the large intestine, millions in the small intestine. So anything that disrupts the proper movement of food and bacteria from the small intestine into the large intestine can allow large intestine bacteria to migrate up into the small intestine. And that can create this condition called SIBO. And the symptoms can be, terrible bloating like this. When patients tell me they wake up in the morning and their tummy is absolutely flat, but as the day goes on, they're getting more and more and more bloated. And by the end of the day, they feel like they're 6 months pregnant. There's an overgrowth there. That doesn't happen, just from normal digestion. Something is creating that gas. And so oftentimes we'll do a breath test, because if we do a stool test, it's normal, because the bacteria that causes SIBO are normally found in the large intestine.
Mhm.
So it's not like you're going to see parasites or an overgrowth of E. coli or C. difficile, nothing. And so these patients, again, come back from testing perplexed why they're feeling so horribly. And it can be bloating, nausea, reflux, diarrhea, constipation. And again, many of the similar symptoms of IBS, but the difference is the tremendous amount of bloat that's involved with this, because the bacteria that live in the large intestine, their main food source is fiber. By the time your food gets down there, you've absorbed most of the nutrients. The only food left for the bacteria down there is fiber. But when they get up into the small intestine, there's sugars, there's starches, there's fiber. So there's food in abundance, and they create gas like crazy, right? It's like, when we make bread, we can make bread either with baker's yeast or we can make it with sourdough. And sourdough is bacteria, right? So bacteria can create gas, yeast can produce gas. And so SIBO is becoming more and more common because different things like low levels of hydrochloric acid, low levels of bile, previous food poisoning, or traveler's diarrhea, even head trauma, believe it or not, anything that influences negatively your peristalsis and the what they call the migrating motor complex. That's strong contractions about 190 to 120 minutes after eating. When you feel that gurgling, later after eating, that's the mechanism propelling the food from your the ileum, the distal part of your small intestine, into your large intestine. If that mechanism is not strong enough to force the bacteria that should be going through into the large intestine, then it can build up in the small intestine and create SIBO. And in treating SIBO, you have to use something to break down the bacteria colonies will create what's called a biofilm. And an easy way to know what biofilm feels like is when you haven't brushed your teeth for a day and you feel your teeth and it's kind of slippery and slimy, that's mucus, right? Mm-hmm. Well, these colonies of bacteria can create biofilms around their colonies. And what it does is it protects them from competition from other organisms. But the biofilms are so strong that even antibiotics, so even strong antibiotics, can't get through the biofilm to kill these bacteria. So they're very tenacious and difficult to treat unless you get rid of the biofilm first. Then even natural antimicrobials will get rid of it, right? So again, this is a condition like irritable bowel that many people are developing, but very poorly treated, because the mechanism of what's causing it and how these organisms are living aren't taking into account, but in the course of the treatment. So the patients just never get better, right? And I've had, a number of people, again, that have had symptoms that they felt that they've had for many, many, many years. And after several months, treated properly, these conditions go away. I mentioned reflux. That's a very, very common condition. And, again, there are things that are affecting the tone of the valve at the top. So the lower esophageal sphincter, I know you guys are nursing students, so you know that anatomy. And for those that you aren't nursing students, at the top of the stomach, there's a ring-like sphincter valve, right? So when you swallow and drink, food and liquid goes down, so the valve relaxes, opens up, and it snaps shut. Well, if that valve isn't snapping shut properly and holding tight, then acid can come back up into the esophagus. Now, your stomach is designed to handle acid, right? It's designed to handle lots of hydrochloric acid by producing a layer of mucus along the walls that protect it from being eaten away. But your esophagus doesn't have that protection. So even small amounts of acid ascending up into your esophagus will cause burning and discomfort. And so again, the conventional treatment, block acid production, right? Naturopathic treatment, figure out what's causing the valve to weaken. Is it overconsumption of coffee, alcohol? Is it allergic foods? Is stress a factor? Yeah. So what's causing the reflux? Deal with that so patients don't have to stay on acid blockers forever.
Mm-hmm.
And symptoms like diarrhea, constipation, they're symptoms, right? Again, finding the underlying cause. And many patients with constipation, we look at diet. Are they getting enough fiber? Are they getting enough minerals like magnesium for proper bowel function? What's going on with stress? Because again, I always say that stress doesn't cause everything, but it can aggravate anything. And your digestive system, from your digestion, absorption, elimination, they work best when you're in parasympathetic mode. Mm-hmm. But unfortunately, most of us today are in sympathetic, we're in fight or flight. And so many functions of the digestive system will suffer when people are predominantly in sympathetic. So, as people try to gain health, things that you can do to activate the parasympathetics will facilitate better digestive function. Yes.
That's so interesting.
So what are some everyday lifestyle and dietary changes we can include in our everyday schedule to improve our gut health?
Great question. So I want you to know that our microbiome, that's the constellation of bacteria. And here we're talking mostly about the gut. We have microbiome in our skin, microbiome in our respiratory system, gut. So now I'm talking mostly digestive system. Whatever you do to nourish your microbiome and nourishing them well determines your health. It's as simple as that. They've studied the constellation of bacteria and people that are meat eaters versus vegetarians, people under stress. It's amazing how different dietary and lifestyle things affect the microbiome of the gut. So my feeling is that, eating a primarily plant-based diet, I'm not a vegetarian myself, I have colleagues that are, I'm not. My belief is that if you're eating a diet that's plant-based, meaning, mostly plant foods, then you're providing tons of food for your healthy bacteria, right? The fiber, the polyphenols, the nutrients, they love all that stuff. What you don't want to do a lot of is the foods high in sugars and simple carbohydrates, because then you're going to be feeding a different class of organisms that like those type of foods, especially the class of bacteria called Bacteroides, and the fungal organisms like Candida. They love that stuff. So if you're eating a diet that's high in sugars, high in refined carbohydrates, you're providing fertilizer for the organisms that you don't want to be in abundance in your gut. So following, what I would call a low carb, Mediterranean or plant-based diet, having some protein if you choose, and with the meats being as organic as possible, because again, the more antibiotics that you're getting from commercial meats, the more you're killing the friendly bacteria in the gut. My wife and I, we tried our best to get organic grass-fed meats if we're eating red meat, organic poultry, wild fish. So we do eat animal products. and we still eat plenty of plant proteins as well. We have dishes that are primarily legumes using chickpeas or lentils. But tons and tons of vegetables, right? And less gluten grains and some non-gluten grains. So your rices, your millets, your quinoas. So, things that are not full of gluten, because again, if you're not gluten allergic yet, if you keep eating gluten, the chances are you will become at least gluten sensitive, because that inflammatory protein is very irritating to the lining of the gut. And many people that grew up eating gluten have become gluten sensitive, and some of you even become celiac. So I try to keep gluten grains and dairy lower in my diet. I'm not allergic to dairy, but again, it's another very inflammatory protein. So if you're not allergic to dairy, have it, but try to eat more of the fermented products, right? The yogurts, the lower fat cheeses, as opposed to drinking milk. Yeah, I haven't drank milk in I don't know how long, but I'm not against using fermented dairy products. I think that that's just another good food to be, including in the diet if you're not dairy allergic. So yeah, low carb and lots of plant foods, clean animal proteins, and keeping the sugars and starches and processed foods as low as possible. Right. And then manage your stress, because stress messes up digestive function, and stress actually affects the constellation of bacteria in your gut. It's just amazing.
Mm-hmm. Sometimes it's hard.
Yeah.
Stress.
It's very hard as a student.
If you've just joined us, you're listening to A Sound Constitution on CHLY 101.7 FM. We're currently interviewing Dr. John Yim, a naturopathic doctor who works at VitaCare Natural Health Clinic on the topic of gut health.
So, probiotics and prebiotics are often discussed in the context of gut health. Can you clarify what these are and their potential benefits for maintaining a healthy gut?
Sure. So the probiotics are the friendly bacteria that reside in our gut. And, when you buy a probiotic product in the health food store, at best, it might have several, up to 10 to 15 different strains of friendly bacteria. But there are literally hundreds of strains of friendly bacteria that reside in the gut. And, many of them we don't use therapeutically in probiotic products. So that's why the best place to get your probiotics from is fermented foods, and especially fermented vegetables, because where the bacteria come from is the soil, right? Like the difference between eating yogurt, right? With yogurt, you start with a lactobacillus culture, and the dairy, and then put the two together, and under low heat, it ferments the milk. With sauerkraut or fermented vegetables, it's the soil bacteria that are on the vegetables. So when you make fermented vegetables, it's the simplest thing in the world. Basically, you're shredding the vegetables, you're adding salt, you're putting it in a covered container, and you just let it sit. And the naturally occurring bacteria that are in the vegetables ferment and create, lactic acid and those substances that compete with other bacteria. And that's how come, fermented vegetables can last through the winter, is that the acid producing bacteria will compete against bacteria that are trying to rot the vegetables, right? They don't keep forever, but that's how our ancestors were able to live on some of these vegetables that weren't root vegetables that normally would have rotted before the winter was out. They would ferment them, and they found that, eating these foods helped the digestive system. And so over time, people like Michnikov, who was one of the early scientists that identified the benefits of probiotics, started isolating them and suggesting that people take them therapeutically. So, I think that for people that don't eat fermented foods, a probiotic is vital, right? To me, a probiotic is more important than a multivitamin, because we know how important the bacteria is for our gut function, our immune function, right? Like 70% of your immune activity takes place in your gut. And your probiotics are a huge part of your immune defense. And then I mentioned mood already, of how important they are for mood, right? So yeah, so either taking probiotics or eating a range of fermented foods is important. And then the prebiotics are the food that the bacteria eat. So many of the good products that you buy, they'll have the letters FOS, fructooligosaccharide, and usually comes from things like inulin, which comes from chicory, and it's the fiber, which is a food source for the bacteria in the capsules. But in the diet, there are specific foods that are very rich in prebiotic fibers. Like if you eat lots of vegetables, you're providing food for the bacteria. There's absolutely no doubt about it. So a person doesn't have to buy a prebiotic product. Eating certain foods in your diet will give the bacteria in your gut food. So you don't have to pay separate for a prebiotic powder to feed the bacteria. So I made a list of some of the foods that are especially high in prebiotics. So this first one, you might not think about eating much, but it's incredibly available and it costs nothing. And that's dandelion greens. Just make sure it doesn't come from a schoolyard where they're spraying pesticides and herbicides, right? But if in your yard, nobody's sprayed and nobody's sprayed there for years, harvesting the dandelion greens, they're so nutritious and yet they're high in a fiber that the bacteria in your gut likes. Other foods are things like asparagus, artichokes, the onion family. So garlic, onions, leek, right? They're especially high in the fibers that feed the bacteria, and they're super good for you. Grains like barley and oats, fruits like bananas, apples. I'm not super keen on eating a ton of bananas anymore because I'm really into trying to keep sugar intake low, and ripe bananas can be extremely, extremely sweet. But if you're making a smoothie and you're adding a half a banana, no big deal. But if you're eating like 2 or 3 bananas a day, that's a lot of sugar. And a couple that you might not think about, ground flax. Like I use ground flax a lot as a source of fiber. And we know that the husk of the seed has, the coarse fiber, but there's also soluble fiber inside the seed that's a good prebiotic. And the last one, which I'm starting to use more of, is seaweeds. We live on the coast and there's an abundance of seaweed. Like you don't know what to harvest, but I get stuff that's prepackaged and it's a powderized, so it's been dried and crushed. And how I use it is, if I'm having soups or stews, I'll just sprinkle it on, and I'm magnifying, the mineral and trace mineral content, and then the fiber in the seaweed feeds the bacteria in the gut. So, and then for calcium, like I don't do dairy much, and seaweeds are extremely high in calcium, super, super high.
Interesting.
Yeah. So if you're eating a variety of these foods, you're feeding the friendly bacteria in your gut.
Super interesting.
Yeah, very interesting.
Wow. So along with probiotics, there are so many supplements labeled healthy and will help with gut health. Are there any that we should avoid, and why?
I think mostly what buyer beware are things like your probiotics. So again, when you buy a probiotic, you want to buy one that has multiple strains. Some of them, like there's a liquid called BioK, and it is a really good product, but I believe it's mostly lactobacillus strain of bacteria. And that strain of bacteria is one strain, right? So we need the lactobacillus producing bacteria, but the bifidobacteria are important as well. So I have a product that I put together has 15 different strains of friendly bacteria. So there's a group of lactobacillus strains and a group of bifidobacteria strains. A line, there's some of these probiotics are being marketed and as being really good for IBS or this or that. But again, they're like singular strains. And to me, it's like growing a garden with one vegetable. That's monoculture. And it's the same with probiotics. When you take a probiotic product, the goal is to take a product that has a range of lactobacillus types and bifidobacteria types. So that's one of the most important things. The second thing is the quantity. So if you're taking something that's either too low in count, so the one I use has 25 billion per capsule, and that's kind of medium, right? You can get ones that are way lower, And you can get ones that are way higher. Like I've seen a patient bring in something that had like 150 billion. And, so those products, if you've had IV antibiotics, you've had multiple rounds of antibiotics, but for the average person, they don't need anything that strong. Like for me, you can actually create a state of small intestine bacterial overgrowth by overtaking a product that has way too much, right? It's hard to believe that you can overdo probiotics, but I've actually had a patient, that's how she got SIBO. She took this product that was way high for an extended period of time, started developing all this bloat. And when she came in and showed me her products, I said, stop this immediately. You're overdoing a good thing, right? The other thing would be digestive enzymes. Many people are using what's called plant enzymes. And I might be a little biased here, but my feeling is that human digestive system does not create the same enzymes as a fungal organism. Anyway, our stomachs produce hydrochloric acid, pepsin, pancreas produces, pancreatic enzymes, liver produces bile. So if somebody's using a digestive enzyme, you want a digestive enzyme that has those things that a human omnivore creature would produce, not a fungal organism in the forest would produce, right? And so that's my argument for a lot of people that say, I've tried digestive enzymes and they don't work. I'll say, have you tried a digestive enzyme that a human would produce as opposed to something that a fungus would produce?
Mm-hmm.
So those are, that's my rant for the day.
That is funny. Have you heard about any emerging research findings related to gut health that you find particularly exciting or promising?
Exciting and very gross.
Oh, I think I know what it is without you even saying it.
So there's the lay term is fecal implant.
Yeah, that's totally what I was thinking about.
Good, we're on the same page. So if somebody develops C. difficile and it's completely antibiotic resistant, several rounds of antibiotics and treating it, finding back stool from a healthy relative and transplanting it into the bowel of that sick person, it's over 90% successful. Mm-hmm. And now they're looking at using this type of treatment for even things like autoimmunity. So it's obvious that what's in the stool is not the poop, it's the bacteria and the antibodies and the different things that are in the stool, right? And the problem is finding doctors that are even interested in exploring this, because there's a doctor here in Duncan. He's actually an anesthesiologist, but very much more alternative minded. And they were importing the stool from a place in England. That's how far they had to go to find the stuff, right? Wow. So it's very, very promising. But I think that it's difficult in getting medical doctors on board, and then also convincing patients that this could be a good thing to do. But
actually, from what I was reading, I heard that it's actually safe, because actually trying to find a match is like under 3%.
Yeah, it's tough.
Yeah, so it's actually very difficult, more so than
Yeah. And this stuff has been cleaned and processed in a way that's going to be safe for the patient, right? So I agree with you that finding a match with a relative is difficult, but finding a supplier that's legit, it is. I mean, you think about it, colitis, Crohn's, there's so many gut related issues that could be benefited, because there's so many people that have had multiple rounds of antibiotics, and their gut flora is just so messed up. Mm-hmm. And, when I've just talked about those three aspects: immune, gut function, mood. I mean, there's so many other things that the gut bacteria do. And so that really excites me. But when I started looking for ways, because in my clinic I have a gal that does colon hydrotherapy, and we were thinking, how can we introduce this in our clinic? Well, we can't even get sourcing for this stuff, right? Mm-hmm. Yeah.
So, I really liked what you said about sitting in your car and meditating before you go home, because you're shifting your energy before coming home, right?
Absolutely. Yeah.
It like allows you to move into your next task,
yeah.
especially without bringing your stress from school or work home on your family.
Mhm.
Yeah.
Absolutely.
Yeah.
Yeah. Well,
Okay.
it's been my pleasure. I hope
Yeah.
you guys enjoyed that. And I think that you guys are doing a great service.
Thank
When
you.
I saw,
So are you.
when I saw that, this goes out to the student community and that, I thought, wow, that's wonderful.
Yeah. Well, we really appreciate you coming on and
Yeah.
sharing your knowledge, your
Oh, you're welcome.
knowledge.
Yeah.
Thank you.
You're welcome.
Okay, well, a big thank you to our special guest, Dr. John Yim, for sitting down with the Sound Constitution to give some context on gut health, where we can use this knowledge as a foundation for making informed decisions in relation to our gut health. If you're interested in making an appointment with Dr. Yim, you can visit the website at www.vita-care.ca or call 250-585-2150 to reach the clinic. I want to thank my co-hosts for sharing knowledge and providing facts on gut health. Lastly, thank you to our listeners for joining me today to talk about a subject that I care deeply about. While it was a lot to cover in a short amount of time, I hope it's created a spark of interest about both the roles of the gut and how we can take action in maintaining a healthy gut. For details and show notes from today's episode, or to follow along on what's coming up this season, check out our Facebook page, A Sound Constitution, our Instagram at CHLY A Sound Constitution, or our Twitter at ASC_VIU. If you've missed parts of this episode or would like to listen to this episode or episodes from our past shows, check out our YouTube at A Sound Constitution. Otherwise, we'll see you next week.